An estimated 60 million people in the United States have hypertension. Often, hypertension is first diagnosed when seeking treatment for angina, stroke, congestive heart failure, or renal disease. Hypertension and renal failure are interlinked. The kidneys are involved in the complex regulation of blood pressure through the maintenance of a normal circulating blood volume and a normal level of arterial constriction. Disorders that affect either or both of these variables can cause hypertension. The renin-angiotensin-aldosterone system regulates arterial tone and circulating blood volume to maintain blood pressure. It does this when the enzyme renin is released by the kidney in response to low renal blood flow. Angiotensin-converting enzyme causes the conversion of angiotensin 1 to angiotensin 2 and 3, which are potent vasoconstrictors. This vasoconstriction, along with the release of aldosterone and subsequent sodium and water retention, results in increased blood pressure. Angiotensin-converting enzyme or ACE inhibitors, such as captopril, enalapril, and lisinopril, work to reduce blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2, which, as previously mentioned, is a powerful vasoconstrictor. The newer angiotensin receptor blockers, ARB, class of drugs, has a similar mechanism of action with fewer side effects. ACE inhibitors are desirable in treating high blood pressure in patients suffering from congestive heart failure because they decrease vasoconstriction, thereby reducing vascular resistance and cardiac workload. But they must be used cautiously in patients with renal disease because they result in decreased aldosterone production and can cause a dangerous elevation in the blood potassium. ACE inhibitors may cause a severe reaction, including angioedema, a life-threatening condition where lips, tongue, and airway swell.
Hi, Teresa. According to the nurse, looks like your blood pressure is still quite elevated. It sounds like you've been trying to modify your diet and exercise, but you haven't been very successful. Do you have any history of any asthma?
No, I don't.
No wheezing, no any problems with your lungs?
No.
No. Okay. Well, medication that I'm going to put you on is a medication called atenolol. It's a beta blocker. And what it'll do is it'll help lower your blood pressure down. Okay.
Beta blockers may also be used for patients with high blood pressure. Beta blockers such as propranolol, atenolol, metoprolol, and the newer carvedilol all reduce myocardial oxygen demands by slowing the heart rate and decreasing contractility by blocking the adrenergic nervous system. Slowing the heart rate causes diastole, the filling time for coronary arteries, to lengthen, which is beneficial in increasing the blood flow to the heart. Besides being described as an antihypertensive, beta blockers reduce the heart's contractility, which in combination with slowing the heart rate makes them very effective antianginal agents as well. They are widely used, but must be cautiously given to patients with respiratory problems because they may cause bronchospasm, dyspnea, and congestive heart failure.
Okay, Teresa, the doctor put you on atenolol, and one of the things that we need to do with that medication is to have you take your pulse. And do you know how to do that?
No.
Okay, what you would do is you take 2 fingers and go along the inside of your wrist.
Patient teaching should include instruction on how to count pulse. The importance of not stopping the medication abruptly should be stressed. If problems are encountered, the patient should call a doctor before stopping the beta blocker to avoid possible sudden increase in angina, dysrhythmia, or blood pressure.